Greetings everyone. Today we are going to see on the topic hand instruments in operative dentistry. So these hand instruments are ones which are going to travel with you starting from your second year till the day you decide to keep your instruments down and retire as a dentist. So wishing you a happy learning. Coming to the introduction, operative dentistry is the art and science of diagnosis, treatment and prognosis of defects in teeth that do not require full coverage restoration for correction. So the main function or the importance of this operative dentistry is in the restoration of proper teeth form, function and aesthetic, while it maintains the physiological integrity of teeth, which is in harmonious to the adjacent hard and soft tissues, and it enhances the general health and welfare of a patient. So the main motto is to enhance the general health and welfare of our patients. So coming to the history of dental instruments, it was seen in way back in 7000 BC that tiny drill bits which was made from flint stones were actually used for carving the tooth. In 3000 BC, it was seen that the literature had shown that using hand instrument, the Egyptians used for discharge of pus from the symptomatic area. In Mayan period, it was seen that the dental drills were even made up of jade stones which were sharpened from one end. Hippocrates in 1350 described something new known as drill driven by cords. Celsus later then modified these drills with one end having a guard to prevent sinking into the tissue, other similar to that of a carpenter's drill. In the Claudius in 2 AD modified this Celsus drill again and called this modulus, wherein a lubricant such as olive oil or milk or dripping of cold water was continuously done. Coming to the later years, Pierre Faucher, who is considered to be the father of dentistry, invented something known as bow drill, which could rotate at a 300 RPM. Later, it was further enhanced by S.S. White in 1874, who introduced the electric motor handpiece. Then came the Borden-Arroter handpiece, which was first clinically successful air turbine handpiece, which you are currently using. And later on came the contra-angle handpiece with having a fiber optic light, which was introduced in 1994. So the early hand instruments were very large, it had heavy handles and was very cumbersome. As you can see in the picture, there's no uniformity or there is no nomenclature which is present in the hand instruments, which would result in injury to the patient as well as inappropriate treatment which could be given by the doctor to the patient. So for this, G.V. Black was the first one who gave an acceptable nomenclature for the classification of hand instrument. Later, Arthur D. Black developed instruments and techniques with various classifications. Then Charles modified these Black's instrumentation. Then came the Dr. Wallstills, who developed the Wallstill chisel, and Ferrier, who developed the Ferrier set, and George Hollenbach, who invented pneumatic condenser. So there was a series of development in hand instruments which was seen. So moving on to a classification. The important classification which is given by Studevant is based on cutting and non-cutting. So the hand instruments are basically divided into two primary things, that is cutting and non-cutting. In cutting, it is further divided into excavators, chisels and others. And in non-cutting, we have our amalgam condensers, mirrors, explorers and probes. So these non-cutting instruments are basically only used for diagnosis and just placing the restoration inside the mouth, just carrying the restorative material inside the mouth. The further classification was even given by Gerald B. Charbonneau, where the instruments were divided into cutting instruments, which was further divided into hand and rotary. Then comes the condensing instrument, then comes your plastic instrument, finishing and polishing instruments, which were again divided into hand and rotary, and isolation instrument and miscellaneous instruments. In cutting instruments, we had the hatchet, chisel, hose and excavators. Rotaries are burrs, stones, discs and others. And condensing instruments are basically pluggers, which are hand and mechanical pluggers. Plastic instruments are usage of spatulas, carvers, burnishers, and packing instruments such as amalgam carriers. Finishing and polishing instruments include your hand and rotary again. So in hand we have the orange wood sticks, polishing points and finishing strips. In rotary we had various burrs, brushes, stones, rubber cups and impregnated discs and wheels which were present. Isolation instruments had the rubber dam of the saliva ejector, the cotton roll, the holder, the evacuation tips and equipments. And miscellaneous includes your mouth mirrors, explorer's probes, scissors and pliers. Coming to Marzuk, Marzuk classified these hand instruments into three: the excavators, the chisels and the special form of chisels. His perspective was only based on the cutting instruments. Coming to the metallurgy, so initially the hand instruments were prepared by carbon steel. Here you can see that it was made by 98% of iron and 0.5 to 1.5% of carbon alone. This carbon steel was known to have immense sharpness, but because of the increase in presence of iron, it had a disadvantage of corrosion. Then the evolution jumped into stainless steel. Here the stainless steel was made of 15 to 25% of chromium, 1% of carbon, and then the remaining was of iron. So this chromium reduced the corrosion which was earlier seen in the carbon steel, but again the disadvantage is that it was not sharp enough, so it started wearing off. To combat this drawback, stellite was introduced, wherein 65 to 90% cobalt was present and 10 to 35% chromium, traces of tungsten and molybdenum, and even ions were present. So here the resistance to acid was seen, and also there was increase in the hardness. So all the drawbacks were slowly combated with the innovation of stellite. Once the instrument is prepared, it has to go to certain heat treatment procedures. 1. Hardening, and 2. Tempering. Hardening is done at 360 degrees Celsius for 3 hours, and this is done to increase the surface roughness. So after hardening is done, then comes the tempering. So once the instrument is hardened, then the tip is reheated and quenched in solutions of oil, acids and mercury at 200 degree to 450 degrees Celsius for 10 minutes. So what does this happen is that it relieves strain, increases toughness. So coming to the parts of hand instruments. The parts of hand instrument is basically the working end, which is in case if it is cutting, it is known as face. If it is non-cutting, it is known as nib. Then comes your shank, which connects the working end and the handle. Then comes the handle, which is either straight and mostly serrated. Then comes your blade angle and cutting edge angle. The blade angle is nothing but the angle which is created when you draw a line along the long axis of the instrument, and again a line passing through the cutting edge. So this comes your blade angle. The line which is drawn long axis of the instrument and along the edge of the edge of the working end is known as the cutting edge angle. So instrument nomenclature. There are 4 things which you need to remember. First is the blade width, second is the cutting edge angle, third is the blade length, and fourth is the blade angle. The blade width is nothing but the width of the blade at the tip of the instrument, that is the working end. Then comes the cutting edge angle. As I previously told you, when you draw a line which is along the long axis of the shaft, the angle which is formed between the line which is drawn through the cutting edge is known as the cutting edge angle. Then comes the blade width, that is the complete width of the blade, and then comes your blade angle, the angle again which is formed by the line which is drawn along the axis of the shaft and the line which is drawn along the blade length. So that angle is known as the blade angle. So yet again, the instruments are either having a 3-number formula or a 4-number formula. You need to remember this. So how do you measure the instrument width the length and all the degrees. So it is either done using a vernier scale. Vernier scale helps us in measuring in millimeters, that is length, and there is something known as Bolly's gauge. Bolly's gauge is nothing but it helps us to evaluate the degree of blade width and blade angle, which is ideal for the instruments. So there are various characteristics of hand instrument which you need to understand. First and foremost comes whether the instrument is direct cutting or lateral cutting instrument. Then comes contra-angling. Then comes the right and the left instruments. The instruments are either single beveled, bi-beveled, triple beveled or circumferentially beveled. Whether the instrument is single-ended or double-ended. So we'll be seeing one by one. Direct cutting and lateral cutting. So direct cutting is the one when the force is applied on the same plane as that of the blade and the angle. So this is called a single plane instrument. For example, chisel. So this chisel is the first and the foremost instrument which you are ideally using when you prepare a cavity in your cubes or the models, right? So it has a single plane which has the blade and the angle. So it is a direct cutting instrument. Lateral cutting instrument is nothing but which has a force which is applied to the along the right angle to the blade and the angle. So this is called a double planed instrument or a lateral cutting instrument. So what is the example? It can be hoe or an enamel hatchet. So wherein you have the force which is applied on the right angle to the cutting edge. Then comes contra-angling. So in contra-angling, you need to remember that when a shank is bent at one or more points to an angle to the blade to gain access or balance. Okay, so when the shank is bent, it is done basically for the instrument for easier access. You should keep it in mind that this shank should not be more than 2 mm. If it is more than 2 mm, the instrument will be out of balance. That is, when you're doing a lateral cutting or when you're rotating, the instrument will start slipping and you'll not be able to use the instrument to its full potential. To solve this problem, the working point will always be 2 mm from the axis of the handle. So this principle is known as contra-angling. Okay. Coming to the right and the left instrument. So the direct cutting instrument is either made for the right or left cutting, and this is based on the bevel on the side of the blade. So if the cutting edge is pointing away from the operator, the bevel is on the right side, it will be a right instrument. If the bevel is on the left, it will be a left instrument. So it's very simple to understand. When the cutting edge is away from the operator but the bevel is on the right side, it will be right instrument. If the bevel is on the left side, it will be left instrument. Single beveled instrument is nothing but the bevel which is present on sideways from the shaft and it is distally beveled, or if the bevel is present towards the shaft, it is known as mesially beveled. Then bi-beveled. The hatchet and straight chisel can be bi-beveled. That is, the blade is equally beveled on both the sides. If you see the tip, you will see a triangular projection either on one side or both the side. So that way it helps in cutting by pushing them along the long axis of the blade. So if you can see, if there is a blank, if there is only one bevel which is seen, it is known as single bevel. If there is two bevel, it is known as bi-bevel. So the chisel or a hoe can either have a single bevel or even it can have a. So triple beveled instrument is basically the bevel which is present and it forms 3 distinct cutting edges. This is seen in angle formers. Circumferentially beveled instrument is nothing but the spoon excavator, wherein the circumference, the circle which is there, it is completely beveled in all the peripheries so that you will be able to easily excavate the dental caries. Then comes the single-ended or double-ended instrument. Single-ended instrument is nothing but it has a blade, shank and a handle. Whereas in double-ended instrument, the handle will have 2 sides shank and 2 blades. So gingival marginal trimmers and enamel hatchet, for example, are double-ended instrument, and chisel is a single-ended instrument. So there are various types of hand instruments. The instruments which are used for examination comes your mirrors, explorers, periodontal probes and forceps. Then instruments used for cutting are excavators, chisels, hoe and hatchet. The instruments for placing and condensing a restorative material are amalgam carriers and condensers. An instrument used for carving and finishing are carvers and burnishers. The other miscellaneous hand instruments are plastic instruments and cement spatula. So the plastic instrument is the instrument which helps in carrying the cement in a plastic consistency to the oral cavity and placing the material. The cement spatula is the one which helps in mixing the cement and to help us get the plastic consistency of the cement. Thank you and happy learning.